Hello, this is Cate Swannell for the MJA. Today we're talking to Dr. Astika Kappagoda, one of the MJA's senior medical editors, about the 18th of August issue. Hello Astika, how are you?
Hi.
Good to see you. Tell us, is there a theme for this issue?
Well, probably one-syllable word, and that's probably fat, actually.
Yeah? Not just diabetes?
Not just diabetes, but the fat in your blood, and also, the fat that people carry around with them, and what to do about it.
Okay. I think in your written in this issue, that's actually in the hard copy, you were talking about a word, obesogenic. What does that mean exactly?
Well, I mean, if you want to, I suppose, the word came about as kind of obese as in obesity, and genic is in something that creates or promotes or sustains obesity.
Right.
And really now there's now a lot of research now accumulating in that we have to now start looking at our own sort of environment, the environment in which we live.
Yeah.
And that doctors actually need to pay a bit of attention to that to tackle issues such as obesity and its related complications such as metabolic syndrome, diabetes, and in this particular issue, gestational diabetes as well.
Okay. So we're not just talking about people who are obese and in need of treatment for their comorbidities. We're talking about preventing it before it gets to be a problem.
That's right. And one of the editorials written by our chief editor, Steve, in association with Shauna Downs at the Menzies Centre for Health Policy, highlights that really this obesogenic environment has kind of quite sort of a fundamental basis in the way in which we live, particularly in cities and in our country and in developing and developed countries elsewhere, that is living in cities is becoming an increasingly predominant way of living. It's a dense environment.
Yep.
It's hard to eat properly or appropriately. It's hard to have enough physical movement, and those things all contribute to obesity. And doctors lie that interface between what a patient does about their own weight,
yes,
how to kind of manage the environment around them.
Okay. So are we talking about encouraging GPs, for example, to be more proactive about the way they approach their patients?
Yes, that's right. And as Mark Harris's editorial has pointed out in this issue, it's not the GP wagging their finger at the patient saying you need to lose weight. What Mark says is that GPs need to be a supportive part of that patient's environment. Yep. To point out the extent of the patient's problem to them, identify what resources are there, whether it's medication, dietary programs, exercise modification techniques, and
yep,
so on, to highlight to the patient is what is out there, and also to ensure that that patient is properly supported by their social network, including by their own treating GP.
Okay. Talk about the research that's in this issue. I think we've got a fair amount on gestational diabetes.
Yeah, look, we've got 2 debate articles about gestational diabetes, and really the whole issue of diabetes and pregnancy is an issue of ongoing controversy. As you and other readers will know, the threshold for just diagnosing gestational diabetes has now been lowered quite significantly.
Yes.
There's still a lot of debate as to whether that lowering of the threshold is appropriate or not. Dev Kavat, in his Clinical Focus article, has suggested that that this actually may result in harms to a patient. You might risk things like maternal hypoglycemia, for instance, or some blood glucose to fall too far.
Is there a risk of over-treatment, over-diagnosis?
Oh yes, this is what Dev Kavat is actually arguing for, that there is a risk of over-diagnosis and over-treatment. And he also highlights other aspects of this. More testing and more diagnosis results in more healthcare costs as well.
Yeah.
And he also worries that the focus on blood glucose and the response to a glucose load tends to narrow the focus of maternal health and maternal and fetal health too much,
Right.
that it tends to de-emphasise other very important aspects of pregnancy, such as maternal obesity, maternal sort of nutrient status and so on.
Okay. This all hooks in really nicely with the podcast we've got tied to this issue with Dr. Alessandro Di Maio, who
Yes.
runs NCD Free, and he's talking in that podcast about changing the way we live, changing cities, making them movement friendly, making them people friendly, but he's also talking about engaging with the big food corporations in a way to stop them,
Oh yes.
well, to adjust their attitude, I guess, from a profit making to a public health view. I mean, it's a big agenda, but I mean, it fits in nicely with what else we're talking about here, and taking responsibility ourselves rather than, you know, letting the government legislate us into the ground, I suppose.
That's right, yes. And we've, you know, in certain ways, we're kind of, with obesity and dealing with commercial interests that promote obesity, we're kind of going down, in certain ways, going down the same path as we went down with smoking, for instance.
Exactly, yes. Yeah.
And
I guess that worked. I mean, it took a long time, but it's starting to work now. So I guess there's hope for changing big issues like non-communicable diseases as well.
absolutely, yes. Alexandra takes a global health perspective, and that implicitly acknowledges that increasingly urban environments pose a problem to human health, well,
Yes.
at least environments as they are now.
Exactly, it's a big challenge. All right, thanks Astika. It looks like it's a good issue. Thank you.
Okay, thanks, Kate.
No.